Good afternoon, dear friends and partners. Today, I would like to inform you a little bit about the implementation of the first in Ukraine program of medical guarantees by National Health Service of Ukraine. First of all, about the funding of facilities that provide medical care to patients with COVID-19. As of today, the National Health Service of Ukraine has already paid over 1 billion hryvnias for the medical assistance to the patients with COVID-19 provided in April. National Health Service executed payments to 25 emergency medical care centers, 236 inpatient facilities, 739 mobile teams. Also, NHSU executed one-time payment to 98 inpatient facilities which had been providing service to the patients with COVID-19 in April, however, were not included in the list of hospitals designated for the hospitalization. This week, the NHSU will start making payments to the medical facilities that provide medical care to patients with COVID-19 in May. Patients with COVID-19 or with symptoms of COVID-19 receive medical services free of charge. Second, primary health care has been working according to the new rules since July 2018. About 30 million Ukrainians have already chosen their doctors and signed declaration with them. For 2 years now, patients have been free to choose and to change their doctor without being tied to a place of registration or residence. Medical facilities began to receive more money, which allowed them to increase the salaries of doctors and nurses. The increases are around 2-3 times. Now it is possible to direct additional funds to improve conditions for patients and introduce additional services. Treatment of cancer is included in the program of medical guarantees. In general, this year, the National Health Service has increased funding for cancer treatment for 70% compared to the last year. Most of the oncology hospitals contracted by National Service received more funding under the program of medical guarantees than under the last year medical subvention. Total increase is around 2 billion hryvnias. The program of medical guarantees includes 6 instrumental examinations for early diagnosis of cancer. Funding in the amount of 1 billion hryvnias is provided for these tests and they are free for the patients. Next, the Affordable Medicines Reimbursement Program. The program has been running for 3 years. Patients with cardiovascular disease, type 2 diabetes or bronchial asthma can receive medication at the pharmacy free of charge or for a small fee. 2,200,000 patients have already received medication under the program, including 62% of people who are over 65 years old. Affordable medicines are available in more than 8,000 pharmacies across the country. Every third pharmacy in the country works under this program. Within the framework of the program, an e-prescription was introduced for the first time in Ukraine. The convenience of the e-prescription became important for the patients during quarantine. To increase the protection of Ukrainians during COVID-19 epidemic, we expanded the program of medical guarantees by including 4 additional packages. The NHSU began contracting medical facilities to provide medical care for patients with coronavirus on May 5th. In particular, just in 4 working days, the NHSU signed contracts with all 25 emergency medical care centers and transferred 124 million hryvnias to them for the treatment of patients with COVID-19 provided in April. I would like to emphasize that contractual obligations under the COVID-19 medical service packages provide for the mandatory provision of up to 300% of salary increase to the healthcare workers who work directly with COVID-19. A budget declaration for the program of medical guarantees for 2021 has been prepared and submitted to the Ministry of Health. It has been designed based on the principles embodied in the memorandum with the International Monetary Fund. I will uncover a few details. Assistance to patients with tuberculosis. We propose to introduce a new package of medical services for the observations of adults and children with tuberculosis at the primary level of care, to stimulate development of outpatient care for the patients with tuberculosis. Emergency medical care. We propose to increase the rate of compliance by emergency teams with the correct patient routes. Psychiatric care. The NHSU offers medical facilities to sign contract for the package Mobile Psychiatric Care. Therefore, it will be possible, if necessary, to send a multidisciplinary mobile team to the patient to provide health care at home. The NHSU proposes to expand the Affordable Medicines Reimbursement Program by including medications for the patients who have suffered heart attack or stroke, as well as medications for people with mental and behavioral disorders for certain conditions. The NHSU will provide to develop the rehabilitation service. 2 new packages of medical services have been developed for patients who have suffered from somatic and oncological diseases. These packages will include rehabilitation service, in particular for patients with cancer and post-cardiovascular accidents, acute myocardial infarction, and acute stroke. Thus, the Medical Guarantees Program will guarantee the provision of a full cycle of medical care, diagnosis, treatment, rehabilitation. NHSU highly appreciate all technical and expert assistance that has been receiving since its establishment. Thank you.